I am honored to introduce our keynote speaker, Dr. Kameron Matthews. Dr. Matthews currently serves as the Deputy Executive Director of Provider Relations and Services in the Office of Community Care at the Veterans Health Administration in Washington, D.C. She also co-directs the Tour for Diversity in Medicine, T4D, an initiative seeking to bring premedical enrichment activities to minority high school and undergraduate students across the country. Founded in 2012, T4D has provided exposure, mentoring, and motivation to more than 3,000 students across 26 states, with upcoming visits to additional states and campuses planned. And if that wasn't enough, last month, Dr. Matthews was named onto the National Minority Quality Forum Advisory Board. So we are delighted to have you here with us today, Dr. Matthews, and thank you for sharing your incredible journey with our attendees. Please remember, Dr. Matthews will be available to answer questions on Twitter right after her presentation. So please send in your questions using hashtag HPW2017. Without further ado, I give you Dr. Kameron Matthews.
Great. Thank you so much, everyone. I'm really excited to join the many listeners around the country, maybe even around the world, I don't know, and just share my story a little bit. So let's get started. I guess I like to share every kind of step along my career about how I've become who I am now, how I've gotten here, and more importantly, who's helped me, because that's my goal today, to help all of you in making decisions and deciding what's best for you as far as your path into health professions. So my story really does start in undergrad, in college. I'm proud to have gone to Duke University. Hopefully there's some Duke students out there listening now. And really, I was that typical pre-med student. Well, actually, very atypical now that I think about it, because I was that one student who really wanted to be a physician. I knew that from the very beginning, but I absolutely could not stand my science classes. And it was just something that I couldn't reconcile in my own head. I knew I wanted to be a physician. I knew I could get there, but I couldn't quite figure out how to do it without really loving the sciences, because you talk to everybody, oh, you have to be a science major, you have to do biochemistry, but I knew there was a way to take a different path, and luckily I had the appropriate advising that told me I could do so. So coming onto campus, I was a chemistry major. Quickly, within the first semester, really decided to step away from that, and I looked towards a department on campus, Department of Public Policy. And for me, that included leadership classes, health policy, but other types of kind of community and family level approach to issues. And that, to me, just became the best, really, resource to figure out how I wanted to be a physician. Not whether I wanted to be a physician, but how I was going to be one and what kind of physician I was going to be. And that was really the beginning of my exposure to becoming the type of physician I'm now. And I'll go into that a little bit further. But really, the concept kind of got instilled into me very early on, being a public policy major. I mean, I still had to take all my science classes. I knew I needed that to get into medical school. But the concept got really ingrained into my heart very early, in that I knew that healthcare providers, we were advocates more than anything else. Regardless of whether you're a physician, a nurse, a physical therapist, you're advocating for your patient, you're advocating for their health, and you have an awareness and a unique set of experiences that can actually make you an even better advocate outside of just that individual relationship, but in the world as a large, at large, in politics, in the media. You can speak to a lot of social and community issues that other professionals maybe can't. So I knew early on I wanted to be an advocate in some way for both individual patients and the community as a whole, but I didn't know what that meant. I just had this sense of I wanted to do more than clinical medicine, and I held on to that. So number one point, don't let go of that gut feeling of the type of health professional you want to be. Have an understanding that there's a way to sculpt your career to fit that in. There's not only just one path, and I'm going to keep saying that. There's not only just one path. So then the concept, when you figure out you want to be an advocate in some sort of way, when you want to do maybe policy work or research work, I mean, advocacy through research is critical. We can't figure out what to advocate for if there aren't good people out there that bring that data together. So being a type of advocate, you need to answer this question. What is your mission? Where do you see yourself? It's not, your mission is not to have a specific career, like a field, to be a physician. That's not your mission. Your mission is to figure out, what do you want to do with your life? Who do you want to help? What is the bigger outcome? What is success for you? And that should not just be, I want to be a physician, because it's so much more than that. So I didn't know how to answer this question. And in fact, I didn't even know this question was so important really until the last 2 years. So I'm going to get into that. I'm going to just keep going into my path. But early on, I want you to start to ask yourself this question. What type of dentist do I want to be? What does it mean to treat patients, to educate them on oral health, to me? And so what type of community do I want to work in? What type of role do I want to take in that community? All of that is part of your mission. So for me, it really was a personal interest in getting to concerns about inequality. So hopefully you have read a pretty landmark report out there by what is formerly known as the Institute of Medicine, but Unequal Treatment is a concept that there are disparities. All of you face disparities in some sort of way, I assume, whether it's based on your race, your gender, your sexual orientation, your identity, what geography you live in, what type of education you had, where your parents went to school or lived. All of those unfortunately result in worse health outcomes. We know this by an alarming amount of data. So one of the quotes actually that's up on the side now was pretty impactful for me, not only personally, but then as I work with this organization called T4D, Dr. Regina Benjamin, one of our former Surgeon Generals, kind of an idol of mine, also a family physician, I'm very happy about that. She really did speak to the fact that the current trend is so alarming that if we don't try to fix this growing ethnic and racial disconnect within our community between those who receive care and those who provide that care, we're not going to be able to fix our healthcare system as a whole. So it's really this concept that we need to work on healthcare disparities, and one solution in that area is diversity within the healthcare workforce. So all of this, I would read about it, I'd be in classes, I'd be in my public policy classes, and it would just be so personal to me. Like, I felt that personal connection to this information, learning about it. So that was where my initial start of concept of mission, where I started to turn my career and concentrate my efforts. So really, it's that gut feeling that I hope you all have as you're going through your classes. I've really kind of spoken to the impact of diversity, but really these are some statistics that, at least on the tour, we like to promote, because it's data driven. We are scientists in this world. As health professionals, you should consider yourself scientists. You should be looking for the data behind any argument that you're making, behind any sort of issue that you're trying to advocate for. And the statistics here are overwhelmingly important in a lot of what I do, and that is the fact that minority providers across the board, dentists, physicians, nurses, physical therapists, we treat more patients that look like us, that are from backgrounds like us, that are even sicker than other patients, that we're making an impact. So this isn't just like a feel-good argument of diversity, it's actually one that's about patient outcomes, so important. But that the flip side of the statistics are actually just as important, that when you actually ask the patients about their impact with their provider in some way, they have increased patient satisfaction, therefore they're willing to sit and talk with their physician or nurse practitioner more. They actually enjoy that communication more and have better adherence to their care plan. So they're actually listening to me when I talk to them. I mean, it's wonderful. So when I'm talking about wanting to be the best physician I can be, this sort of data, again, really hit home to me, because I wanted to be able to make the best impact possible. So all of this, again, to get back to the question of what is your mission, find your data. It doesn't have to be diversity. I'm just using this as an example, but find that one area of interest within health professions, or maybe it's completely tangential. I actually went to school with a couple of people who their passion, their mission was focused in music. but they were still in medical school with me. So they ended up combining their careers and looking at music therapy to help people with mental health issues. I mean, it's brilliant. Their passion was there. They had a mission about healthcare, and they figured it out. Healthcare to me encompasses so much of what we are as a community, as an individual, as a community, as a society. So there's many different ways that you can tie it all together, but these are just a couple examples. So the next point in my story, I get through undergrad, I get to medical school. I'm still completely, like, as much as I've been through, I'm still completely shocked that I got into Johns Hopkins. An amazing experience. I knew early on, though, that I wanted to be a family physician. For me, family medicine is that critical position that ties multiple different pieces of healthcare together. I wanted to be that doc for every person out there. I didn't want to say, oh, I can't treat you because you're a male. I can't treat you because you're too old. I can't treat you because I only do kidneys. You know, I wanted to be able to help everyone. And so somehow I got into Johns Hopkins. I still thank them to this day. But I knew that they didn't really train many people in primary care. In fact, I ended up graduating my entire class. There were 2 of us that went into family medicine. That wasn't the point, though. For me, the point was I'm going to get the best education I possibly can. I knew that family medicine was going to be an interest and a training ground for me later in my career. So I didn't jump straight into, oh, I know I want to be a family doc, so I need to go to this school because they train the best. As far as family medicine, I was looking broader scope, and I wanted the best education I possibly could. I wanted the networking that Johns Hopkins can and does bring. And I connected with the students there more than any other campus that I visited. And for me, that was going to be success through med school. I knew I could get a medical degree at any number of schools, obviously. An MD equals a DO equals an MD. But I wanted to succeed. And I really feel like I did so at Johns Hopkins. So that's school, though. For me, the biggest education by far was outside of any sort of classroom setting. I ended up joining an organization my first year of medical school called the Student National Medical Association. SNMA is an organization really that supports underrepresented minority students in medical school. We're in MD and DO granting programs around the country. I still say we because I am still an alumni officer. I'm actually an emeritus. I got all the way up to serving as national president one year. I do way too much. But part of the education that I've gotten over all of these years was working in that organization, being outside of the classroom, working with others, managing my time, managing my studies at the same time because you're a student first and foremost. Managing, we had employees, we had staff, we had a headquarters, we had conferences to run. I mean, these are all transferable skills. A nice, very good phrase you can use in your next interview. These are transferable skills that although, you know, you learn them in one setting, you can apply them elsewhere and still be successful because those skills are so necessary just in the workplace as a whole. That was formative for me. I took that experience, I took all that I learned with one of my best friends in the world, who I don't even know if he's listening today, probably not because he's a little too busy for me these days. I took that and really took it to the next level, and with my best friend started an organization that I've mentioned and that was mentioned in my bio called the Tour for Diversity in Medicine. These are some of my best friends in the world up on these photos, and our mission, again, getting back to mission, our mission was really clear from the beginning. We wanted to reach those students that were not coming to conferences, that weren't going to the typical pre-med programs, that weren't at those top 25 schools that med schools and dental schools and everybody just like for some reason consistently recruits from. We wanted to go find the students that were maybe the diamond in the rough. Or really not even the rough. It's just like the diamond in the ignored communities, basically, because a lot of these schools we went to were pretty amazing. So that's what we did. We have our green shirts and our gray fleeces, and we get on this bus and we go around the country, and we work towards this mission. Again, I keep going back to the same thing. We work towards a mission of really forming local connections in order to fill a national need. That national need is trying to impact healthcare disparities, again, but by doing so, by educating, cultivating, and inspiring future physicians and dentists. And now we're doing pharmacy as well. We have our first pharmacist on the tour with us, and we're so proud of the work that we've done. Hopefully, I've met some of you along the way. We've had a couple of repeaters as well who've come to a couple of our days, and even a couple of our mentors actually met us on the tour as students, got into med school, and now they're working. I mean, that's just like the best success in the world, that we've been able to encourage them as much as we can. But really, again, my education in working with my own organization, other organizations, this is more education than any medical degree, or sorry, I haven't mentioned it yet, law degree could possibly provide. So yes, I got my law degree as well. You probably saw my degrees on the first slide. Let's see, how do I connect that to my story? Oh, in undergrad, so public policy, I knew I wanted to be an advocate more than anything. I get to medical school and I realized, okay, well, there's this whole concept of public health. There's this school of public health at Hopkins that's world renowned. All my classmates are applying to public health school. And I just could not, it was my third year, I could not in any way answer this one question on the application. It was like something so simple. Like I even just had to fill out the application, a real just kind of administrative thing, just submit it. All of us got in, and I couldn't do it. And I meet with one of my mentors, family doc, I love it, who asked me a very simple question, and I'm going to ask you guys, and feel free to actually tweet me about this, actually, because I just think it was so life-changing. Do you want to be a seeker or a user of data? And having come through the sciences, but also coming through public policy and everything, I knew immediately, there was no hesitation to that question. I just said, I mean, it was probably a few curse words in my head, but at the same time answering it, you know, I don't care where it comes from. I just want to be able to use it. I want to know that it's good. I want to be able to interpret it, but then I want to impact something by using data. And she said, well, you don't want to do research. I said, I know. And she was like, well, why don't you go to law school? I was like, because I'm a third year in med school. She said, so? And wow, I was blown away when she said so. I was like, because you just don't do that. And in my mind, I realized, like, why don't I do that? Why can't anyone do that? What's stopping me? I was creating my own path. So as much as I think it took me, I think I had been working on my personal statement for School of Public Health for like a month. I finished my law school applications in 3 days and took the LSAT 2 weeks later. I went to law school that next fall. Never regretted it since. Have become a better physician because I became a lawyer at the same time, because I'm a better advocate. So I know how to argue for my patients. But no, I'm not even that type of lawyer. You know, I know I have a legal mindset, I have an analytical mindset that helps me not only help patients individually, but then as I've gotten into policy roles and policy making, I clearly can speak both languages between medicine and law. And that's entirely helpful, as so much of our healthcare system now, I think, is due to the fact that there's not enough clinicians in leadership roles who understand the law. So that's my whole role. So anyway, that's how I have pulled together a lot of my experiences through different organizations, through my different degrees. Even with both of my graduate degrees, I completely credit my experiences outside of the classroom with more of my education. And I strongly suggest that all of you, please do not just take part in organizations because it's a box to check off on an application. It's an experience that will make you a better health professional. That's what I want to hear when I'm reading your application, and trust me, I'm going to read many of them. You know, I want to know why your experiences will make you a better physician. I want to know why you working at that, I don't know, summer camp will make you a better dentist. What about that experience? What connection did you make with people will make you a better health professional? So that's kind of how you need to approach it. It's not about checking off a box on an application. So I get through law school. Okay, I'm jumping ahead. I get through law school. I still knew I wanted to be a family physician. All of this was just, I was like, how am I going to reconcile all of this? There's so many different pieces. How am I going to do this? Because I actually got through law school thinking, I'm just going to go back to med school, finish that 4th year, and then I'm done. I'm going to stick with law. This is my world. You know, I think I'm a better lawyer. Please, I never practiced law. But at that point, I thought I was going to be a better lawyer. Go back, finish 4th year, get accepted to a family medicine residency in Chicago. So I went to law school in Chicago as well. Start my residency, and trust me, it's miserable. You can't even really, I mean, everybody on Grey's Anatomy for some reason is like happy or sleeping with someone or doing something. Maybe I'm not supposed to say that on a webinar, but I mean, you guys have seen the show. This is a public show. So anyway, you know, it just is, it's not accurate. Real residency is not a fun time, and I was miserable. And I thought I was confirming everything. I'm just going to be a lawyer. I can't do this. This is just not why I got into medicine. That was the most disappointing thing. That was not why I got into medicine. And then I finally got to one of my rotations my second year. So it was only after a year and a half. I'm talking finally, like it was years of this, but no, it was just my second year. And I go do a rotation at Cook County Jail on the west side of Chicago. For those of you who are not aware of what Cook County Jail is, it is the largest single facility county jail in the country. Jail is also where you go pre-conviction. So this means these people have not been convicted of a crime yet. They're still waiting for their court date. More than 10,000 people are in there on any given day. I mean, it's absurd. And as far as advocacy, one of my personal issues is definitely surrounding criminal justice reform as a whole because of my experience there. But this was probably one of the more important patient populations I've ever helped. The most, there's so many mosts actually. I mean, most of these people don't have primary care. They only go through emergency rooms. They tend not to really interact with a lot of the systems that we depend upon. They have their own system in their communities and are somehow forced into this world of corrections because of a mistake that they made or some blatant crime that they made, but they're now locked away and serving their time. It was eye-opening as a physician for so many reasons that you can certainly imagine. I've never been in a jail in my life. I'm probably blessed to say, unlike many other people, maybe even listening now, that I haven't had any family members go to jail. Like, I've never visited anyone in the jail. This was, I mean, trust me, my dad hated every second of every day that I worked here, his little girl, going to a jail every day. But for me, I felt like I could be most impactful, that on any given day, I was touching, reaching, helping, being there for more people than I ever had outside of that setting. And then as the advocate in me, as the policymaker in me, the next step started. I started realizing, and I was working on committees and taking leadership roles there, that the correctional facilities are actually an unbelievable place to really practice public health and to have an impact on public health, just because of the number of health problems that the inmates face as far as chronic disease, sexually transmitted and other communicable diseases, the amount of education that you can do because they're in a controlled environment, unfortunately very controlled lockdown, but that when you're discussing patient populations, it's critical to have an understanding of their social needs, of their criminal justice needs, and that in order to impact communities, we could really do so by just addressing what's going on in the jails and what's impacting those patients to actually get into the jail. So this was eye-opening. I mean, if any of you have read the book, The New Jim Crow, that speaks to a lot of we're having this debate now in politics. Hopefully you guys are paying attention about the opioid crisis and drugs and jails as a whole. I mean, I got passionate. You can tell I got passionate about these issues as I was working there. So that was pretty eye-opening to me. I will most likely go back to a correctional setting to practice medicine again. I feel that tied to it. I felt like I've never made such an impact as I did for any individual patient that I worked with while I was in there than I have outside. So anyway, that was my first kind of special patient population I think of. I was ready to leave there just because I was mainly treating men, so I wanted to do more women's health. I wasn't seeing kids at all, and I wanted to take care of kind of chronic disease, although I hate to say it, I had a couple of patients that were in there. I worked there for 2 years. I had patients that were in there pre-conviction the entire 2 years, so very upsetting. But I wanted to do more kind of bread and butter family medicine, so I left and went to what's called a federally qualified health center. An FQHC for short is a kind of safety net entity. Community health center, they're also called, or health center for short. This is where a lot of our Medicaid patients in this country are treated. Medicaid, you aid the poor, as opposed to Medicare, you care for the elderly. That's how you distinguish. Bring that up in an interview. So at an FQHC, it was, for me, Another great experience is, see, I was just lining up my experiences. I can't believe I've already done all this in my career. But it was another great experience because I was working not just with family docs, not in a correctional setting, but across the board. I had OB-GYN and dental and peds and adult medicine, and I had a lot of people in my one clinic, and I was starting to really focus on other social determinants of health because at FQHCs, we don't just treat the person, we treat all of the different issues that impact that patient. So whether it's transportation or their utilities or food insecurity or housing more than anything, how can we actually improve patient outcomes? You can't do it just by giving somebody a medicine or by stitching something up. You actually have to treat the community, the world that they actually live in, and that impacts their health and wellness. I actually worked at 2 different FQHCs. I got a bit of a promotion after year 1 to another FQHC where I became chief medical officer. That was, first of all, I'm still very young, but I was very young when I got that role, especially in my career, and I was kind of blown away. But my leadership roles, again, tied with my interest in advocacy, tied in my mission to impact health disparities, really allowed me to kind of practice my medicine in a different way because I had these leadership roles, and I got to really focus on population health because I was responsible for all 13 of our clinics as opposed to just my patients. So I had to think about larger scale decisions of what type of services we're going to offer, how frequently we're going to offer them, how we're going to expand them or shrink them down if we can't afford to do them any longer, how am I going to recruit docs to do them because our community is impacted if I don't have the right number of psychiatrists and social workers or dentists or things like that. So all of these decisions really helped me grow. It was scary, but for me, again, my mission to treat patients as comprehensively as possible, it was, all right, I'm stepping out of just being that physician for one doc, and I'm being a physician for a whole population, a whole community. So that was pretty impactful. Let's see, where in my career? Oh, so after chief medical officer, I was ready to move home. I was in Chicago still, been there about 13 years, and I wanted to move home, which is important. All of you should try to be around your family as much as possible. Your career is not worth jeopardizing those relationships or not being around your parents, and I was really ready to get back to closer to Philadelphia. I wasn't quite ready to go back to Philly, but I started looking in the DC area because I could drive. And then I made the decision, after looking around, I was looking at other FQHCs in the area, even all the way up to New York. I was testing the waters. This position came up that I'm currently in at the Department of Veterans Affairs. Totally new. Totally unlike anything I've ever done. I mean, I've worked at the VA in residency. I did my ICU and my surgery months at the VA in Chicago, but never would I thought that I'd be in this central executive role. And I'm loving every second of it. It is very stressful, but the learning point with this role is how I actually got it. I was looking all over, typical places, websites or journals, for positions that were posted at FQHCs and things like that. I happened to then sign on to LinkedIn. And for those of you who don't have professional looking LinkedIn pages, this is essentially your electronic resume that people can leave comments on, they can give you recommendations, but people literally in executive roles hire people off of LinkedIn. And I mean, we hired our chief finance officer for my last hospital off of LinkedIn. And so I'm looking, I'm like, oh, there's job postings. Oh, okay, let me just scroll through here. They might be just posting physician positions here. And I happened to find this link for Veterans Affairs. And I read it, and I said, wow, this is kind of cool. So over provider relations, I'm responsible for connecting through a couple of big national contracts, the VA with community providers. So we have a community network of 550,000 providers around the country, and I'm responsible for making sure that our network of those providers is adequate for our needs. So what we can't offer in the VA, we turn towards the network. And I run 2 national contracts to help do that. I had no idea how to run this kind of contract. I had no idea what it took, but I wasn't fearful. I was thinking about my transferable skills, and that was actually how I interviewed. I was very upfront about the fact that I've never done anything to this scale. I haven't worked at the VA, but I've run clinics. I've worked with patients. I've worked with patients with issues, whether it be social determinants or criminal justice, and I've advocated for them more importantly. And it's actually quite paid off. I feel like I'm in a good fit here, and I'm happy about it. So it's interesting. And I bring these three kind of areas of where I've worked in, corrections, FQHCs, and VA, because it took me forever to figure out how they were all linked for me personally. Remember that one question I asked at the beginning, what is your mission? I hadn't asked myself that question yet. I knew, like for some reason I just thought, oh, I want to be a physician. I thought that was adequate. It's not adequate. Physician is the name of your title. It's not what you're working towards. That's what your mission should be. And as I was thinking about, my gut reaction, I want to work at the VA, but how does that tie? How am I going to convince someone how that ties to what I did at the FQHC and what I did in corrections? Am I going to look like I'm just jumping around, not making decisions? And I realized after a great conversation with another mentor, very important, notice how many conversations I've had with people over my career, I realized that my mission, just easily described, was about getting patients access to care, no matter what type of patient it was. In the jails, I wanted to make sure that they knew how to interact with the healthcare system, and that while they were in the correctional system, they were treated with dignity and actually had their healthcare taken care of. In FQHCs, it's about the uninsured and the Medicaid. So how can we make sure there's enough resources? In the VA, again, it's about resources. We can't offer it, we can't afford it, we just don't have it in the VA. How can I build a network to make sure that veterans have access to care no matter where they live in the United States or even outside of our borders, wall to the south. So, you know, I think I sat up one day, literally, like, I feel like I've had so many of those revelations over my career. I sat up and I was like, oh my gosh, all of this is tied together. I finally figured out, I finally knew how to describe it, because my gut reaction was that it was all tied. And so for me, as I go to my next position, you should always be thinking about your next position. I'm not going to tell you when I'm looking towards my next position because I don't want to get fired. But when I'm looking towards my next position, I'm going to know now what to look for, because I'm interested. My gut, what I want to do with my life is to get people access to care. There's other points of healthcare that are important, right? Is it about getting high quality care? Is it about research? Is it about even very particular areas of focus within a certain specialty? No, for me, it was like, I just want to make sure that no matter who you are, that you equally can get access to some sort of care, to make sure that your wellness is addressed. And that's not what we have, unfortunately, equally in this country. So that's my passion. That's how I connected everything. And I want you guys to find your passion, because there's no way you can't enjoy all of this work that you're about to do and all of the delayed gratification, because, again, you're going to do stuff that you don't like. Remember all those sciences I had to take? I didn't like any of it, but I needed it, and I got to where I am. The difference between an adult and a child is, as an adult, you actually do things that you don't want to do because you realize what the outcome is going to be when you're done. As a kid, you just sit back and say, I don't want to do it. And that's the difference, the delayed gratification of getting through your training and getting to where you need to be. And I got here, and I've enjoyed every bit of it, and I want you guys to. So that's why I want you to find a mission and where you want to go. And please don't try to find it just now. Just go with your gut. Go with what you want to do. Because remember, I just told you, it's only before this last job. I've only been in this job the last year, and I'm not going to tell you how old I am. But it took me a while to figure out what my mission was. So just keep that in mind. So really, the mission-oriented decision-making is kind of what I've already discussed. But it goes to so much more than just making decisions about where you want to work. But it's also about who you want to be an advocate for, what type of people you want to work with, who you want to surround yourself with, what type of organizations you want to volunteer with. I mean, all of us are much more largely focused than just getting that paycheck. You wouldn't go into the health professions if that's what your interest was. So where's your mission, and what kind of decisions are you going to make every step along the way to make sure that really your happiness and your satisfaction is taken into account. So where am I now? Still at the VA. Like I said, it's only been a year. I don't regret any of the decisions that I've made as far as my career. The only one that I questioned at one point, and this was purely, I'm looking at the people in the room, this is purely because of the dentist on the tour with me. The only thing that I regret at one point was not considering dentistry at some point, because oral health in and of itself impacts every patient possible. Like, yes, you're treating you know, my what I said before, I wanted to treat a whole person, but oral health impacts your entire body, your entire wellness, your sense of self-esteem, everything. And I had a great conversation with Dr. Young, who's on the tour with me. Everybody look her up. She's on our tour website. She's phenomenal. Shayla, you're great too. Shayla, I know you're our budding future dentist, but Dr. Young is amazing. And she was the only time that I really sat back and said, maybe I should have reconsidered dentistry. I'm not going back to dental school. I have enough degrees. But there's nothing wrong with questioning and thinking about the impact that other careers can make for you. So consider I mean, that's the whole point of Health Professions Week. I want you to consider every single option that you have in front of you. And again, how it connects to your mission. Again, that's the important part. So really my lessons learned, my biggest 3 points that I think my career really encapsulates more than anything is have a mentor, talk it out, get those questions asked and answered and everything at multiple stages, both in your career as well as their career. As a student, you should have somebody older than you in school who's your mentor. You should have somebody at the next stage. So in dental school, in physical therapy school, you should have somebody who's a new grad. You should have somebody older. You should have a team of players. Because trust me, that older person does not remember what it was like their junior year applying for school. You know, and that med student may not really be able to connect much on choosing specialty or whatever, but they can tell you what it was like that summer that they were applying. Like, you need to have advice across the full spectrum of where you're going with your career. So definitely I recommend that. Take advantage of all opportunities outside of your traditional position, meaning don't just study. Like, yes, you need to be a great student, but join those organizations, get some experiences outside of the classroom setting. I mean, it's required, don't get me wrong, for the application, but again, it has nothing to do with the application. This is about becoming the best health profession you can be, and I truly, truly believe you can't learn that in the classroom setting alone. So please get outside of that. And then create your own path. If somebody else has done it, to me, that's just kind of boring. I mean, I want you to find those mentors, yes, that you can emulate, but learn from bits and pieces of them. Figure out what your path is, figure out your own mission, and it will take you much farther, especially with that personal satisfaction that you really need in order to take this long journey. Healthcare or training in healthcare is a marathon, not a sprint, and you need to be happy along this path in order to be successful and make it through. Because trust me, I don't shy away from this at all. I almost left for residency twice. I was that miserable my intern year. I almost left twice. I was just going to walk away, having gone through all of medical school. I thought about it and I got back to it. And I realized what the long-term goal is. I didn't realize mission yet, but I realized what my long-term goals were. And then eventually I got through the residency piece, and I realized I could be happy in medicine. It was just that residency. It was just that one part that I needed to get through. So you grin and bear it, and you put your feet in, you dig your feet in, and you can make it through. So please feel free to reach out to us at the tour. We share our stories like I've shared mine. We have YouTube videos where everyone shares their bios of advisors telling them no, and they're now practicing physicians or dentists out there, of failures, of successes. We want you guys to connect with one of us, so we really, really would love to hear from you. And join us. I don't have a calendar year for 2018, but we'll get that out soon. And all of our many partners that have helped host this Health Professions Week will be involved with the tour, actually. We'd like to involve as many of these organizations as possible because we know we need all of you in order to help us really address healthcare disparities. So visit us online. And I thank you guys so much. I'm going to be around, tweet to me and everything. I'm not going to give you my personal handle because y'all are going to blow me up, but please tweet us through Health Professions, although you can probably find it now that I think about it. Yeah, you can all find it, actually. But I'm still not going to give it out. I'm going to make you find it. I'm going to make you work for it. But please send us your questions now, and we'll try to answer as many as possible.